Cuspyd name derived from the canine tooth, and as you all know the importance of canine tooth, it has a very important role aesthetically and functionally. Imagine a smile without canine.
The wait is finally over because here we are with another episode of Tooth Talks, navigating your dental journey. This one is a special one because it is the last one in our series for NEET MDS Counselling. Hi, I'm your host, Dr. Ichita Joshi. I would like to thank Cuspyd, which is an evolving EdTech company which aims to transform the way in which dental professionals learn and grow. Over the past few weeks, Cuspyd has supported us to make better decisions on our career and also given us some expert views about life after BDS. So I guess you all must have been really curious as to what is Cuspyd and how and what they are doing. I guess you'll find out that today. Remember, I said that this episode is special. So today we have the founder and the director of Cuspyd. I'm really excited to introduce her finally. So meet Dr. Rajshree Dasari, who is a consultant periodontist. Ma'am has done her BDS from Sri Sai Dental College in 2007 and MDS from Panania Dental College in 2012. And ma'am has been a passionate clinician throughout. And she's also a very keen academician and a researcher with multiple publications under her name. And she's also a speaker at various national and international dental forums. Welcome to the show, ma'am.
Hello, Ichita.
So, ma'am, can you tell us about your journey as a periodontist? How did it start? And from periodontist to the director of a tech startup for dental students, how did it all end up?
Basically, most of my family members are doctors. My dad is siblings. So I usually love being around their conversation regarding patients, surgery, cases, etc. And in dentistry, there are two branches which deal with more of surgical part, that is perio and oral surgery. And also way before, when I'm doing my BDS, I came across many beauty pageant shows where they used to tell the secret behind the award-winning smile is the combination of sparkling personality and great cosmetic surgeon.
Definitely, ma'am.
And the pageants used to tend to approach the dentist to look their absolute best. So in a way, perio, again, it deals with more of aesthetic surgery, smile designing, etc. It's a correct mixture of aesthetic and the treatment cases and all.
Yes, ma'am.
And it is such a branch where it connects medicine to dentistry.
Definitely.
So, and periodontia is nothing but it deals with soft tissue, that is gums, and it is as just crucial as teeth. So it plays an equal and important role in achieving that beautiful smile. So this could be your option too. So coming to Cuspyd, I was an academician, means I joined academics after my master degree. And as an academician, I want to give my students best. And I always wanted them to learn better. And during my teaching experience, I always felt adding a visual content to the subject will make the student understand in a more better way. And I know the information what textbook gives is much more way ahead. I mean, our goal is to make the student visualize the structure, visualize the procedure, the anatomy, the total physiology. Because student can't forget that visual thing what they have seen. And the total perception, it need to be changed. So, for example, all the subjects or the content is same for medical and dental during the first 3 years. So, it's almost the same textbooks and all. But how the student should take the subject. For example, if it is when we come to biochemistry or student directly will pass from inter and they enter into the dental field. And they keep studying about vitamins, nutrition, carbohydrates, your physiology, etc. So we are incorporating the subject in such a way that it will change the whole perspective of the student, how he will take the subject and how he can use that knowledge in his coming future or in his clinical practice.
Yes, ma'am.
So we are trying to incorporate that for every topic or subject. So let's see.
That's really great. And I'm really excited to see all that coming up because it's a new age way to study things.
Yes.
And it will definitely transform the way in which dental students are learning the subject. So ma'am, one thing that a lot of our viewers are wondering that what is the significance behind the name Cuspyd? why did you choose it, and what exactly is the play on words here?
Cuspyd name derived from the canine tooth. And as you all know the importance of canine tooth, it has a very important role aesthetically and functionally. Imagine a smile without canine.
Oh, I don't want to imagine.
Like that. And just in a way, canine acts as a transition tooth between the front and back teeth.
Yes.
So we, Cuspyd platform, want to act as a transition or provide a student a smooth transition from his school life to BDS and from BDS to MDS.
Okay.
So we are trying to add the technology and digital content to it, as I told you. So we want to make all 3D visualization and so that the subject becomes easy for the students. So if you see our logo, it's a tooth symbol with a play button.
Yes,
Yeah.
yes,
So that means you click the play button and you find all the material related to the dentistry. So click on to the play button and log in for success.
Okay.
So if you see the logo, it's login for success.
Yes, ma'am.
So the play button acts as a key for your success thing.
Wow, now we know the reason why. Because definitely Cuspyd is a very catchy name and it is related to the dental field. But then it's really nice to know such a deeper meaning and significance behind that whole name. So ma'am, coming back to periodontics, what type of cases do periodontists usually see?
Periodontists do a wide variety of cases because, as I told you, it's a branch where dentistry is connected to medicine. So they are allowed to manage a case in an interdisciplinary manner. Okay. And coming to procedures, they perform all the procedures from simple to complex, like simple procedures from scaling, your frenectomies or operculectomies, to a complex procedures like your full mouth flap surgeries, your root coverage procedure, and various regenerative techniques, and your pre-prosthetic surgeries, and implants, again part of perio, and your depigmentation, your cosmetic surgeries like depigmentation, etc.
Okay. So a lot of things are
And
taught
also,
in this.
like we can do maxillary sinus lift procedures.
Okay, ma'am. So it is a variance from basic procedures to
To
advanced
the
procedures.
advanced procedures.
Okay, and lot of surgical skills involved in this. So ma'am, can you tell us more about how is this course spread out in 3 years? And is there any recent advancements that the students should learn in periodontics course?
Yeah. So most of the students, they think perio is calculus. There is a lot more than calculus. So if you see the 3 years plan, during your first year courses, like first 6 months, you are allowed to do your hand scalings and ultrasonic scalings we allot to the students. So this also, the student should get familiar with the instruments, your patient management and your grip of the instrument so that you can handle the tissues delicately. And you'll have a major task of submitting thesis. There again, you have to study articles, your journals, etc. to select a good topic. So that is a major task. Once it is done, by the end of first year, you will be given your single tooth flap surgeries and very minor surgeries like operculectomy, frenectomy and all. And once you enter the second year, you will be allowed to perform the full mouth flap surgeries and various regenerative techniques and any complicated procedures and all. If you are well versed with that, you can go for implants, or third year will give the implant placement and all. Parallelly, you will be having your seminars, journal clubs, etc. So that will go on.
Okay, ma'am. So this is a very vast and extensive course. So I would say by second year onwards, one is more likely to perform all the advanced surgical procedures.
By the end of second year, you should be able to perform the advanced, and you can assist the faculty in more complex procedures.
Yes, ma'am.
And you can also have, you'll get a chance to teach your juniors so that you can be well versed with the subject.
Yes, ma'am. It's an ongoing procedure of learning and growing. Okay, ma'am. So, ma'am, that is a very vast and extensive list of all the procedures that you've given us. So, one more thing that we would like to know is there any prior skill set that a student should have if they want to join MDS course?
Yeah, definitely. The student should have a sound knowledge of all the basic subjects. So that's what here we Cuspyd platform also providing base for the MDS students too, because MDS is such a course, it will be very hectic to concentrate on all the basic subjects and also your specialty subject. So here we are providing where you can brush up all the basic sciences subjects, and so this app is for both MDS and BDS. So where MDS can brush up all the old subjects, and BDS you can build up a strong foundation which can be used for the future career.
Okay, ma'am. That definitely seems like a platform to look forward to. So, ma'am, since you told us about all the procedures that a periodontist usually does, so what is the scope and job opportunities that one get in this branch?
Okay, so once you finished your MDS course, you can as well join academics, and or you can go into the clinical side. And if you see the academic side, then if you're still interested in subject part, you can pursue your PhD. Most of the European countries are there to provide for nice PhD options. And or along with academics, you can also go for a clinical practice, or you can go as a consultant, like that. And coming to clinical practice, you can always set up your own clinic, or you can enroll yourself into corporate clinics and also into government sector, but you should follow the notifications and all. And if you see the clinical part, most of the Middle East countries have a demand for periodontist. And again, depending upon equipment in your college and all, you can be well versed with lasers and various regenerative techniques where you can try.
Okay, ma'am.
So you have demand for that laser flap surgeries and your regenerative technique and cosmetic side.
Yes, ma'am. So I can see there's a lot of scope in India as
Yes,
well as abroad.
As well as abroad.
Okay, ma'am. So you've given us a really good insider knowledge about the branch of periodontics, and that was all the technical part. So I have also a few fun questions lined up for you.
Yes.
So shall we jump straight into
Yes.
it? So ma'am, this one is called Would You Rather. I'll give you two options. You just have to pick one according to which one you like
Sure.
the most. So ma'am, would you rather treat a gum disease with laser or a scalpel?
Laser. Many people opt to that.
Yes, advanced procedure.
Advanced procedure.
Ma'am, would you rather treat a patient with mild gum disease or severe gum disease?
Both have equally their own challenges and all.
Okay.
So ultimately what we achieve is matters.
Yes, ma'am. Would you rather work with children or adults?
Both. Like,
Ma'am, would you rather teach dental students or practice periodontics full time?
I would say not full time, but both, because as I told you, all this have started because I want to teach better to the future generation, and also I don't want to leave my clinical side. So I want to be in touch.
Okay,
so
ma'am,
that I
you're
can
aiming
give
for
better-
best of the both
best of
worlds.
both.
Nice, nice. So, ma'am, a dentist is also defined as a doctor, engineer, and artist. So, out of all these three, which one defines you the best?
Mostly artist, but I would say all three. And that engineering part, because I'm into tech also. So
Okay.
I've completed that engineering part also. So all three.
Finally, ma'am, what advice would you like to give to a student who's just about to join MDS this year?
MDS Perio. Firstly, because the subject is vast, I would like to say you have a lot of options to select your thesis. So select unique thesis. Don't go for old articles or the repeated dissertations. So go for unique things, because tissue is the issue. So always you can look for various new regenerative techniques. And whatever the theoretical knowledge and all you grab in the first year itself, try to read as many books as possible and articles, and try to follow the journals, etc. And so that second year you can concentrate more clinical procedures, and again do as many number of cases as possible. And so that, because these 3 years are precious. Once you go out of the clinic, or the course, in your own practice, like, you can't experiment. Here you will have your senior faculty, everybody to help you. So try to opt or go for newer regenerative techniques or new clinical procedures. They're always there to help you. Parallelly, you have fun also. Try to attend conferences so that you meet new speakers and all. So you will get to know new topics. So what is going on? Update yourself and have fun.
Okay. I hope all our viewers made a note of all the golden advice which ma'am gave. So before we wrap up this session, ma'am, would you like to tell us more about Cuspyd and something that our viewers can look forward to?
So I would like to tell everyone, be on a lookout for Cuspyd and follow all our social media handles like YouTube, Twitter, Instagram, etc. And we are coming up with more informative content and shortly a platform which is exclusively for dental students. And there is something for everyone to pick and learn from. So we are trying to create an exclusive like one-stop solution for all the material related to the dentistry. So click on to Cuspyd and log in for success.
So that brings us to the end of this episode. So do subscribe for more such content. And thank you so much, ma'am, for coming here and giving us your precious time and knowledge.
Thank you, Ichita. It is really nice to have you here. And we are really thankful from our team for hosting all the faculty members. And I hope it is useful for all the students who want to take up MDS.
Well, I should rather thank you for this opportunity because it was definitely a great experience for me to interact with so many people and bring out some great knowledge and views about our field.
Thank you.
For those watching this video, do let us know what you're thinking in the comment section, and do follow the Instagram page of Cuspyd because they're putting out some really fun and educative and informative content there. Thank you and have a great day and stay tuned.